Peace, family. It's your friendly neighborhood psychologist, Dr. Milo Dodson. Because of all of today's events, I kind of feel like I need to start this video out by saying my fellow Americans. But we'll save that kind of video for like 20-ish years from now. Now, to be clear, I am not a medical doctor, and this video is not medical advice. I will leave that to the qualified and certified mental health professionals. Additionally, while this video is not therapy, I humbly offer it for emotional support and for highlighting important resources. So, as a licensed psychologist in the state of California, I want to start this video off by validating and normalizing the full range of emotions that we all may be feeling as a result of the COVID-19 pandemic. It is completely okay and absolutely understandable to be feeling scared, anxious, sad, uncertain, even angry, or all of the above as a result of the coronavirus. What is not okay, and I'll say this louder for the people in the back, what is not okay is to be minimizing, memeing, or, pardon my English, talking shit about people who have tested positive for coronavirus. With all of this being said, it's essential that we remain diligent about checking the source of our news, because we're not just in an era of fake news, but we're also in an age of an abundance of misinformation. For example, regardless of a person's position or title, say, I don't know, president, their information should continue to come from medical professionals and scientists. If it doesn't, we should tune them out and change the channel. Because scrolling through social media does not make you an expert, nor does it automatically mean that you are properly informed. As a personal example, even though I have a PhD in counseling psychology, I too am looking for reputable outlets, such as the Center for Disease Control, or CDC for short, for guidance and for information. At UC Irvine, we've learned about a concept called social distancing, which is a public health concept to reduce the probability of individuals who are currently carrying or may be carrying a highly contagious disease. This means that it is up to all of us to take the necessary preventative measures. So in addition to practicing social distancing, please wash your hands. If you can't wash your hands, use hand sanitizer with at least 60% alcohol. Additionally, it's really helpful to keep your hands away from your face. Super weird to say, but super helpful. If you feel sick, please stay at home. Now is not the time to be trying to get extra brownie points and prove that you're a hard worker. With that being said, please also call your primary care or emergency room prior to showing up, so calling in advance, so that in that way they can guide you in the proper steps for seeking medical treatment. So to close this week's video, I want to end kind of how I started by highlighting not just the physical health preventative measures, but also the mental health preventative measures for coping with such a scary, anxious, and uncertain time. There are things that we should be doing on the regular anyway, like washing our hands and getting enough sleep, but now is the time to really prioritize these. Please be encouraged to talk with others and reach out for emotional support, and also encourage others to engage in ways of de-stressing. Now is also the time to be practicing radical self-care, viewing maintaining our mental health as just as much of a requirement as we do with anything else in life. We are indeed living through uniquely challenging times, and while I can't predict the future, I do know that we will get through this together, because I got you, you got me, and we got we. And we will remember to continue to love and be loved.